think the most enjoyable parts of it are when you're assessing a patient and you're giving them that time to talk. I think for a mental health patient, that's the biggest thing, that you're giving them that validation, you're giving them that time to talk. It's that little bit of extra time that probably goes the mile, really. And probably hearing at the end of a call that you've supported them so much and they actually feel listened and valued. It's also nice to kind of get that response from a crew as well, when you feel like you've helped them on scene when they've had a difficult job and you've been able to ring back and kind of debrief them to a certain degree, or either signpost them to the most appropriate person, really. So I qualified 13 years ago now. I've been with EMAS for 3 years now, and it's somewhere that I've stayed the longest in a job so far. Really enjoy it, and it's something that I've always wished I'd done sooner, probably. So my job role is mental health clinician within the CAT team. Sit within a group of clinicians, from paramedics to general nurses, work alongside the MDs and dispatchers, and just ensure that people are triaged in a timely manner, and making sure that people are either signposted to the most appropriate place, or that they're obviously sent an ambulance as an emergency response if required. The jobs very much vary. So from 1 minute you might get something that's not too challenging. It might be very easily signposted, where you can get jobs that people are at the most desperate, people are the most frightened, and they can be very highly emotionally and highly charged situations, especially when family are involved. A really good team here, where everyone within the CAT team is very supportive. I've got supportive managers, I've got a very supportive family at home. Obviously try to keep myself occupied. I would always talk about something or have that little bit of a chat with someone if I needed that little bit of time afterwards. But there's not anybody that you can't turn to here within the team or within the whole EOC, really. I think it's a very rewarding job. There is very difficult days, there is very draining days, but ultimately it is a really good job. I found that it's fit more around my family life. I've got more time to spend with my family. Like I say, I've worked with a really good team. I've had a lot of different experiences here. I actually was presented with my first award, which I was really chuffed with when I first started with EMAS. And I think it's just a whole round different career, really. I'd always dreamed of working in the ambulance service, and now I've been able to do it.